In India, the spread of the virus into rural areas is putting limited health facilities under intense pressure. Despite rising numbers of infections, the Indian government says there is encouraging news about the rate of recovery from the virus. But some parts of India have reimposed lockdown restrictions, others have chosen not to for economic reasons. Our correspondent Yogita Limaye reports now on India's battle with COVID.
COVID-19 has reached rural India, where hospitals are often just buildings with no staff or equipment. Bring oxygen, a woman pleaded, searching for doctors at a medical facility in the eastern state of Bihar. Her family struggled to revive her father-in-law, who was unable to breathe. He died before a doctor could see him. Many are asked to take loved ones to the nearest big city, Patna. But here too, conditions are grim. Mani Bhushan's uncle was treated in an ICU, where there were dead bodies lying in the beds right next to him for nearly 36 hours. His family claims doctors rarely did the rounds. Avdesh Singh died a few days after the video was made. The situation in Bihar is so pitiful. The government says there are facilities, but you realize when you go to a hospital that only God can save your life. More than 1,000 miles away, the scene is starkly different now, in a part of India that was the first to be badly hit by the virus. This is one of many field hospitals built in Mumbai to treat COVID patients. Now that they've opened, people aren't struggling to find beds like they were a month ago. Because of facilities like these, even with the highest number of cases in the country, Mumbai for now is being able to cope with COVID-19, as is the national capital, Delhi. But given its size and population, India is almost like a small continent, and there's been a variety of responses to the pandemic. The eastern state of Bengal has decided it will shut down for 2 days every week. Madhya Pradesh in central India has reimposed stringent restrictions, while the southern state of Karnataka lifted a planned lockdown because of economic compulsions.
India will never reach simultaneously a peak. Each area will have its own peak. Higher the density, higher the peak.
As coronavirus spreads rapidly, floods have killed scores in the country. The threat of disease even higher during India's rainy season. Yogita Limaye, BBC News, Mumbai.